Hello everyone, my name is Michelle Lose and I am currently in the Psych Mental Health and P track. I chose to do my project this semester on youth suicide prevention. I chose this topic because in my current career as a bedside nurse in the pediatric ICU, I have unfortunately seen many patients and families that have been impacted by youth suicide and suicide attempts. I also feel that a lot of people are unaware of the relatively high prevalence of youth suicide. Suicide is currently the second leading cause of death for age groups 10 to 14 and 15 to 24. In 2017, suicide claimed the lives of 517 children between 10 to 14 years old and 6,252 between the ages of 15 and 24. Some statistics from the Youth Risk Behavior Survey unfortunately revealed that this problem is actually getting worse. For example, in 2007, 2% of high school students were injured in a suicide attempt compared to 2.4% in 2017. Some other statistics include 17.2% reporting seriously considering attempting suicide in 2017. 13.6% reported making a suicide plan. My PCOT question is, among adolescents, how do in-school suicide prevention programs compared to no in-school suicide prevention affect self-reported post-intervention rates of suicide attempts, suicidal ideation, and or deliberate self-harm within 6 months? Although schools aren't necessarily a common place that nurse practitioners provide care, I feel that it is the perfect setting to be able to reach the vast majority of youth, and I really think that schools should be more heavily utilized as a setting for providing mental health education and suicide prevention. For my supporting literature, the first article I chose was a systematic review that looked at the impact of various psychosocial suicide prevention interventions for youth. This article actually included 10 different interventions that took place in the school setting. 6 of these interventions were effective, 4 had significant differences in suicidal ideation, and 2 had significant differences in suicide attempts. One example article from this systematic review was one study that looked at the impact of a program called Signs of Suicide. This program was a 2-section psychoeducation program that was delivered in a group setting. 3 months following implementation, they found significant differences in suicide attempts. So there was 3.6% following the intervention compared to 5.4% before. My second article was a cluster randomized control trial that evaluated the efficacy of 3 different in-school suicide prevention interventions. There were a large sample size in this study. There was 11,110 youth over multiple different schools. The 3 different interventions were: 1, a question, persuade, and refer, which was a gatekeeper program that had training for teachers to be able to identify students at risk. The second was a youth-aware mental health program, which was an educational intervention for students that included interactive lectures, role play, booklets, and they were able to learn about depression, anxiety, suicide, and tactics for dealing with stress and coping skills. And then the last was just a screening by professionals, and in this intervention, high-risk students were identified and then provided with help. The only intervention that was found to be effective in this study was the Youth Aware Mental Health Program. For this intervention, both suicide attempts and suicidal ideations were significantly decreased at 12 months follow-up. My final supporting article was a qualitative study that looked at a group of adolescents' experiences with a school-based suicide prevention educational program. There were 5 students in this group. They learned how to support one another, they learned about mental health issues, and they all created presentations about suicide prevention. Following this group, the researchers conducted semi-structured interviews and got data about the adolescents' opinions and experiences with this group. And overall, there was lots of positive feedback. Mostly this group was found to foster resilience, and it created lots of positive relationships. One example quote from a participant was, "I've been more aware of people's actions and how they feel, and I can pick up when people feel depressed or suicidal." As far as applying this research, school-based suicide prevention programs with a mental health component are effective in reducing suicide attempts and suicidal ideations for youth. With this knowledge, nurse practitioners and other mental health and or medical professionals really need to advocate for these types of programs. We need to continue to research to see which prevention interventions are the most effective, and we need to be providers of education for teachers and counselors and other professionals that will have lots of interactions with adolescents on a daily basis. So overall, my proposed intervention would be that every middle school and high school in the United States would have a yearly requirement for an age-appropriate mental health and suicide prevention education. These programs could incorporate education about depression, stress, coping skills, and where to go for help if you or a friend needs help. And on the last page, I attached my references. Thank you for watching.